you who have joined so far. As we wait just a few more minutes to give people time to log in, I just want to mention that today's webinar is part of our ongoing Listen and Learn educational series, where every month we focus on a different ear or hearing related topic. Our goal is to educate, inform, and answer any questions that you may have during this unique interactive session with members of our medical and audiology team. If you'd like to watch any of our previous webinars, you can download them from our website. Just go to eardoctor.org/events. You can see the address at the bottom of this slide as well. Just a few housekeeping items. During the session, your audio and video will be turned off just so that everyone can easily hear the speaker. We'd also like to encourage you to use the chat function to submit your questions at any time during the presentation. Dr. Shohet will be happy to answer all of your questions at the end of his presentation. We also have enabled live captioning for this presentation. So if your Zoom account has this feature turned on and you are not seeing a live transcript on your screen, simply click on the live transcript button on your toolbar along the bottom, and then select Enable Audio Transcription, and you should see the transcription appear on the bottom of your screen. Okay, I think that covers all the housekeeping items. So let's go ahead and get started. Today we have a very special presentation by Dr. Jack Shohet on hearing loss and the latest advancements in hearing technology. For those who may not be familiar with him, Dr. Shohet is the founder of Shohet Ear Associates. He's a distinguished physician and surgeon. He's board certified in both otolaryngology and neurotology, and implanted the first implantable middle ear hearing device in Orange County, and continues to pursue new treatments for hearing disorders and related problems. In fact, Shohet Ear Associates as a practice was first to implant a variety of technologically advanced hearing devices, one of which you'll hear more about today. So without further ado, I'd like to turn it over to Dr. Shohet so he can share his expertise and insight with all of us today.
Thank you, Juliet. And I'm hoping that everyone can hear me. Juliet, are you able to give me an affirmative?
Absolutely, hear you loud and clear.
Okay, great. Thank you. Thanks for the introduction, and thanks for all the people behind the scenes and making this happen. This actually takes a lot of work, even though it's a Zoom meeting. A lot of people are involved in putting this together, and I really appreciate all of your help. I want to also acknowledge my co-presenter, Gina Patskowski. Dr. Patskowski is a doctor of audiology here in our practice, and she'll be helping me with some of the questions at the end of the session. And so I think I'll probably start from here. I'm going to share my screen with you. Let's see. So today's presentation is titled, Do You Love Your Hearing Aids? So it's kind of a loaded question. I think a lot of people might answer emphatically no to this. That certainly was the case 20 plus years ago when I first started my practice, but more and more as I've seen that the hearing aid sound processing and new options have become available, more and more people are starting to love their hearing aids. I was at a recent meeting, and there was a doctor that has that currently wears himself the technology that we're going to talk about today. And he says that one of the things when he goes to see his patients, he'll ask them if they love their hearing aids. And if they don't love their hearing aids, then they need to be moving on to something else. And I think the point here is that if your hearing instruments are properly fit and if your expectations are fairly reasonable, you'll find that hearing instruments of today will provide the benefit or more benefit than you can with technology of previous. And so much so that I think a lot of people feel like their hearing aids are indispensable, that they open up a whole new world to them than what is accessible without them. It's been a lot of fun to watch over my career. So let me see how I advance. I guess I clicked there. So today we're going to talk about hearing loss, the problem. Why are we talking about hearing loss? What are the issues around this? We'll just go over a brief review of how we hear and the different types of hearing loss. And then finally, we'll talk about some of the different options that are available to help you hear, with more emphasis on a newer technology that we'd like to present today. My name is Jack Shohet. Our practice here started off as William House Hearing Associates. It was almost exact. We're celebrating our 20-year anniversary this year. So Dr. House was my colleague previously, and he left me the practice back in 2001 when he retired. I see some of his patients still today, and it's been really a great pleasure to be able to walk in his footsteps. We are a medical and audiologic practice, which makes us somewhat unique. I'm a doctor of otology, neurotology. I'm an ENT doctor by training, and I did specialty training in both otology and neurotology. So I specialize in ear and ear-related issues, and I work with a team of doctors of audiology here in our practice. And so it's that collaboration between the medical and the audiologic that makes us unique, and I think very effective in being able to treat the issues that we see. Because of this, we offer all hearing solutions. So we can not only do hearing instruments, but we can offer hearing implants as well. So it's never one, we're never trying to fit everyone into the same thing. We're able to offer everything, every type of solution to you. We were the first in Orange County to implant middle ear hearing devices. And we were the first in the Orange County to offer numerous other hearing technologies. That's been kind of my interest throughout my career, is looking at and learning of and helping develop new hearing technologies to help our patients do better. We've been implanting and programming cochlear implants longer than any practice in Orange County today. This is what we're trying to avoid. This is I noticed this in one of our patients' cars in our parking lot. It was the first time I saw her, but I thought this was pretty amusing and pretty much summarizes exactly why we're here. So the problem, hearing loss, turns out behind back problems is the second most common disability in the United States. It affects 11% of our population. A third of those over 65 years of age have a significant hearing loss, and half of those over 75 years of age have a significant hearing loss. This gives you an idea of what age ranges are affected. And you can see, I mean, hearing loss even affects the very early ages and congenital types of hearing loss, all the way up until the more senior ages. But you can see it starts ramping up between 35, 45, between 55 and 65. There's a pretty significant incremental increase in the incidence of hearing loss, and then it just gets even more significant as we get older. So what happens when you have untreated hearing loss? This has been pretty well studied in the past. There's been a lot of studies that have documented these effects on people who have untreated hearing loss. They tend to be sad and depressed through those lacks of contact and being unable to hear. They tend to be more worried and anxious. They tend to be more paranoid. You know, if they can't hear what's going on around them, people must be talking about them. There's less social activity. You tend to get more isolated because you're not hearing as well. And, you know, sometimes this is a subconscious effect. You may not really notice that's why you're not doing as much, not going out as much, but a lot of that may be because you're not getting as much out of it because you're not hearing. There's emotional turmoil and insecurity surrounding people with untreated hearing loss. And we now know that it does take its toll on the brain. Over the last 8-10 years, there's been a lot of information published on the cognitive effects of untreated hearing loss. when you have a hearing loss, your brain is not getting all the stimulation it needs from the inner ear. So over time, that part of your brain, which helps you with hearing and comprehension of words, it starts to atrophy. You start to lose function in that part of your brain. And that's cumulative and progressive. And after a point, wearing hearing aids becomes more difficult to do because you're not getting as much benefit because your brain has become too deconditioned to the sound. So what we've been finding is that when you have a hearing loss, your brain, you have to start using parts of your brain that are not normally associated with hearing in order to be able to comprehend what is going on in front of you. So your brain starts pulling from other parts of the brain that shouldn't be active with hearing, and that takes away from what the brain is able to be doing from its normal functions, such as memory. So we have found over the years that hearing loss is associated to dementia. In fact, people with untreated hearing loss have between 2 and 5 times higher risk of developing dementia compared to the general population. People with treated hearing loss don't have an increased risk compared to the general population. So let's talk about how we hear. So briefly, this is a cross section of the ear. This is the outer part of the ear. This is the ear canal. So the outer part of the ear acts as a funnel through which the sound gets funneled down through the ear canal. It hits the eardrum here and then sets these little tiny hearing bones into motion. These hearing bones are the hammer, the anvil, and the stirrup, or the malleus, the incus, and stapes bone. These vibrate in and out of the inner ear. They set up a little fluid wave here in the inner ear, which gets converted to electrical energy and sent up to your brain through the hearing nerve. This gives you an idea of the scale of what we're talking about. This is the last hearing bone in the chain. It's called a Stapes bone. And obviously this is a dime. There's basically 3 types of hearing loss. The first type of hearing loss is called a sensory neural type hearing loss, or nerve type hearing loss. And that's a problem with the hearing at the level of the inner ear or the hearing nerve. Now, this is the type of hearing loss you get associated with the aging process. Noise can cause this, certain medications that can cause it. It's certainly the most common type of hearing loss that we see. It is typically irreversible. There's nothing we can do about this type of hearing loss in most cases other than to wear hearing instruments. The second type of hearing loss is called a conductive hearing loss. And that's a problem with the hearing getting from the outside world to the inner ear. So it can be something as simple as wax blocking the ear canal. It could be a hole in the eardrum. It could be a problem with fluid behind the eardrum, or it could be a problem with these hearing bones. This type of hearing loss is reversible because we can take out the wax, we can fix the eardrum, we can drain the fluid, we can even fix these hearing bones. Now, this is a lot less common type of hearing loss. And when you have the two combined, you can have what's called a mixed hearing loss. So you can have both the conductive and a sensory neural hearing loss together. So one surprising statistic is that 80% of those people with hearing loss wear hearing aids regularly or not at all. So, why? Why is that the case? And the number one reason is that it's poor sound quality. People feel like they don't hear that well with their hearing aid in many of these cases. So what are the options to help you hear? Well, that depends on the type of hearing loss and the severity of hearing loss. We've got conventional hearing aids, extended wear hearing aids, osseointegrated hearing devices, implantable middle ear hearing devices, and cochlear implants. So this may be possibly the most important slide I have in this whole deck. And this has a lot to do with expectations with hearing loss. it's very important for people to understand there is not going to be a cure for their hearing loss. As much as we'd like to do that at this point, that is not going to happen. Our goal in rehabilitating people's hearing is to help them hear the best that they can possibly do with the anatomy and the physiology that is happening in their inner ear and brain. That means that we're not going to be able to get you back to hearing like you were when you were 20 years of age. But in many cases, in overwhelming majority of cases, we can get people hearing significantly better than they were without their hearing device. So some of these options include conventional hearing aids. I think you've probably all seen people wearing these types of hearing aids. They come in all different shapes, sizes, and even colors these days. There are extended wear hearing devices that are worn down deep in the ear that get replaced every 2 to 4 months. There are osseointegrated hearing implants that are implanted to the bone behind the ear, and these are for people typically with conductive hearing losses and single-sided deafness. There are cochlear implants for people that are severe to profoundly deaf in both ears or in one ear. And finally, there are implantable devices or direct drive devices that are used for the middle ear. Now, these typically are used for sensorineural, for mild to moderate, or even moderately severe sensorineural hearing losses. And I want to explain the difference between an acoustic system and a direct drive system at this point. So we're all pretty much familiar with hearing aids and acoustic hearing aids, and these work by taking sound from the outside world. They then process it in the hearing aid, and it's compressed and filtered, and then it's amplified, and it's delivered back to your ear canal as sound. It then has to hit the eardrum, then vibrate the hearing bones, and they get processed by the inner ear and sent up to the brain. Now, with implantable or with direct drive systems, you remove one of those steps. So what happens is sound comes in through some type of processor. It's compressed, it's filtered, it's amplified, and then it's delivered directly to the inner ear as energy. So it's not converted back to sound. It's directly delivered to the inner ear as energy. And by avoiding this conversion back to sound, you can actually improve some of the characteristics of the sound that's delivered to the inner ear and eliminate some of the distortion that you might have with this acoustic type system. And so the result is a lot of times we can increase the amount of sound that the patient hears. And it also means that the sound is oftentimes clearer to them. So these are implantable middle ear hearing devices that incorporate this direct drive system. These devices, they can be partially implanted, they can be totally implanted, but they all have in common that they directly drive the inner ear with energy. They don't convert the sound back to sound. Today, we're going to talk about a new type of direct drive hearing device, and that is the Earlens. The Earlens is a non-surgical device that is placed on the eardrum, kind of similar as you would expect a contact lens sitting on your eye. This lens sits on the eardrum, and it then vibrates the eardrum directly and provides energy to the inner ear. So what does a lens mean for you, for your hearing? Well, this is a hearing test. This is what we call an audiogram. An audiogram gives us a fair amount of information in terms of where a person hears according to different frequencies or pitches and how much sound is required to get them to hear. Sometimes the right and left ear are superimposed on the same graph. But you can see here this information, say at 500 hertz, we can see this person hears at 500 hertz at 35 decibels. That means that everything beyond 35 decibels, they need 35 decibels or better to be able to hear a sound. Anything less than 35 decibels, they're not going to be able to hear. And to give you an idea what that means, this is the range of everyday speech. So the sounds that we're normally hearing in our environment fall within these frequencies and these thresholds. So if you have hearing loss that extends beyond this area that's here in white, you're probably not going to hear all the sounds that you're supposed to be hearing. So many people with hearing loss are missing over 50% of the sounds, the possible sounds that they should be hearing. Once you start having a hearing loss, you are going to start missing parts of speech that may be important for you to be able to fill in all the information that you need to hear. So to give you an idea, this is an audiogram, and you can see where the different parts of speech fall within the audiogram. So up here in the higher frequencies, you can see the consonants, the things like F's, S's, THs. The consonants in speech are up here in the high frequencies. It turns out that most of the time, when people have a sensorineural hearing loss, their hearing loss is affected in the high frequencies, and so they start losing these parts of speech. Here in the lower frequencies are mainly the vowels and some of these other sounds that are not as often affected. So what happens when you can't hear all the sounds in speech? Well, then you're not hearing all the parts of the words that you need to hear. So 63 in sunny may become 53 in funny. You know, you probably know someone or have yourself been involved in a situation where you thought you heard someone say one thing, but it really turned out to be something completely different, although they sounded a lot alike. And that's a lot because you're just not hearing all the parts of the speech that you need to hear. So in order to get the best speech of understanding, you really need to hear as much of the full range of sounds that you possibly can. So traditional hearing aids are limited by sending sound waves through the air. And that's what we just talked about. You know, they get funneled into the ear canal, and they're only able to amplify a certain amount of the frequencies that you need. So you can see they're designed, a lot of these hearing aids, conventional hearing aids, are designed to provide this high frequency amplification. And they do a decent job at it. And honestly, they're getting better and better all the time. But there are some limitations in that the way they work is not going to be able to provide you amplification out to some of these higher frequencies that some of these newer technologies are able to do. So what does the Earlens do? With the Earlens, because it sits on your eardrum, because it's able to directly drive the hearing bones with energy, you have a broader frequency response. You have more access to the full range of sounds. And what that means is, for a lot of people, better speech understanding and a much clearer sound. So Earlens vibrates the eardrum to provide better hearing. As we talked about, there's the lens that sits on the eardrum, and there's an outer portion that hangs over your ear. It looks a little bit like a hearing aid, and it hangs over the ear. And what it does is it collects the sound. This part behind the ear is the microphone. It collects the sound. It then compresses it and filters it, and it delivers the sound through your ear canal as an energy that is picked up by your lens that causes the lens to vibrate. And then the lens vibrates on the eardrum and sends that information directly through your inner ear to your brain. So Earlens gives you 2.5 times the bandwidth of conventional hearing aids. You can see with from a conventional hearing aids, these are the frequencies that are oftentimes amplified. Earlens extends that, and normal hearing is usually much better than both. So a peer-reviewed study conducted by the National Center for Audiology and published in Trends of Hearing found that Earlens provided superior across several hearing measures including the ability to better understand sentences and situations with louder background noise, and to more accurately recognize consonant sounds that are critical for distinguishing words. It was named Best of 2020, one of the best inventions of 2020 by Time Magazine, in terms of, and that incorporated the broad spectrum of different innovations at that time. So the device is custom fit and programmed for an individual's anatomy and hearing loss. So what's involved is, typically we will see a patient, determine that they are a candidate. We will take a deep ear mold impression of the ear canal. So right here in the office, we will take an ear mold impression where we put material down that goes all the way through your ear canal down to the eardrum, and take an impression of the actual eardrum. So it is custom fit for the individual that we're making it for. Then we send the lens over to the company. The company then fabricates a lens based on the ear mold impression that we give them. And about 2 weeks later, we get the ear lens back, and we insert the lens into the ear canal. And this outer portion that's worn over the ear then fits into the ear canal, and it's fit to the ear and programmed. It's non-surgical. These devices are rechargeable. So there's a battery within it that just gets recharged. You don't have to charge anything. It comes with a little charging station. And they're Bluetooth compatible with Apple products, which means that you can stream music with it. You can also program it with your phone. So what we typically do, meet with the audiologist and the physician to determine if you're going to meet the criterion for an ear lens. We'll look at the anatomy and we'll determine, based on your hearing test, whether you would be a candidate. We then take an impression, as I just spoke about, a deep ear mold impression here in the office. And then we place it 2 weeks later after it's been fabricated. And finally, you come in for programming periodically after we fit it the first time. You may need to come back 1 or 2 more times just to have it tweaked to your liking. And then after that, most people, about once a year, we recommend they come in, get a new hearing test, and make sure the device is working well. There is a little bit of maintenance with it. You use some mineral oil in the ear canal to help keep the, first of all, to soften the wax, but it also helps keep the lens stuck down on your eardrum. It works similar to a contact lens, where your tears help to keep the contact lens stuck to your eyeball. The mineral oil helps to keep the lens stuck down to your eardrum. I think that's what I have for this. And I know that there's usually a lot of questions, so I left ample time to be able to address those. And let me just turn it over also to Gina to see if she has anything to add.
No, I think you covered most of it. There are some questions that I see coming in, so we can address some of those. And please keep asking questions in the question and answer box or the chat box, and we'll get to all of those. Okay. Dr. Shohet, the first question was, what causes hearing loss? So I thought maybe you can answer that one.
Sure. So there's a lot of different causes for hearing loss. Hearing loss can be congenital. You can be born with hearing loss. Certainly the most common cause that we see is both genetic later on in life and hearing and aging related. But what happens essentially for sensorineural hearing loss is that there's a degeneration of the function of the inner ear that then leads to the hearing loss. So there's many, many different causes. It can be caused by infection. It can be caused by noise. the treatments all boil down to the same things that I talked about today. Not acoustic. Go ahead, Gina.
No, I was going to say the next question, but you can see them too. So go ahead.
So if not acoustic, what form of energy is the hearing aid feeding the inner ear? So the hearing aids do feed the ear with acoustic energy. So that slide I was showing you, sound goes in through the hearing aid and then it gets processed and then it gets delivered back to the eardrum as sound. So it is acoustic energy that a conventional hearing aid feeds the inner ear. The direct drive hearing devices feed the inner ear with mechanical energy. So it directly moves the hearing bones that are attached to the inner ear.
Someone asked about the negatives to the Earlens.
Are there negatives to Earlens? Well, it is a hearing device. You have to take it off at night. You won't be able to wear it overnight. So you have to take it out to charge and to give your ear a rest overnight.
It's more expensive than traditional hearing aids.
It is more expensive than traditional hearing aids.
And the process is a little more involved with the impression and getting the lens placed than a regular hearing aid as well.
Right. Yeah.
Once you require a hearing device, do you usually advance to different models, or the first device is usually the only one needed? So any hearing aid, we usually recommend upgrading the technology every 4 to 7 years. Technology is changing a lot every year, and as your hearing progresses and your hearing needs change and the technology has limitations, we do recommend that you do upgrade that technology. And the cost of the Earlens, so for 2 devices, the cost is $11,900. So it's definitely more expensive than a traditional hearing aid, but it does offer quite a bit more. Of that amount, the 900 of it is non-refundable for the impressions and the materials that are used during that. And then you do have a 60-day trial period. We also do recommend that you have had worn hearing aids before trying the Earlens, but we have so many different options and so many different price points to cover so many different types of and degrees of hearing losses. So don't let that price stop you from coming in. Swimming with the Earlens, Dr. Shohet, do you want to answer that one?
You can swim with the Earlens. If you're going to swim a lot, I'd recommend you wear an earplug, but yeah, water is not an issue with the Earlens. You can swim with the Earlens on.
And then someone asked about how the transmitter fits on the back.
Sorry, Gina,
Oh,
I need to back up. You have to take the external part off though. Remember, I showed you the slide where there are 2 parts to the system. One sits on your eardrum, like that's the Earlens, and the other part is the processor that's over your ear. That part has to come off of your ear before you swim. So you won't benefit from wearing the Earlens when you're swimming, but you'll be able to swim.
And someone asked about how that transmitter fits on the back of the ear. It's very similar to a traditional hearing aid. So it has that behind the ear part that sits right on top of the ear with the wire coming down, and then a piece that seats itself in the ear. So it does just kind of fit on there like a traditional behind the ear receiver in the ear hearing aid. Is the impression painful?
So I do the impressions. I'll put the ear mold material in the ear, and it is a deep ear mold impression, so it's uncomfortable. It's usually not tremendously painful, but it is uncomfortable, I would say, when you take something that deep in the ear canal. There's no way to get rid of that completely, that discomfort, but it's usually very well tolerated.
Can the volume of the Earlens be adjusted? Yes. They do have buttons on the back of the processor like hearing aids do that can be programmed to adjust the volume or programs for different environments. The Earlens also can be connected to an iPhone. Right now it's only iPhone compatible, not Android. And so with the Earlens app, you can also adjust the volume or program of the device. And I know the Earlens goes deep inside the ear. The piece connected to it also goes inside, nothing outside of the ear. And do I remove these daily? So like we said, the lens portion will stay on the eardrum, but without the outside piece, you're not going to get that benefit. And so the outside piece is similar to a traditional hearing aid, and that's the part that you take off every day. The lens stays on your eardrum for years. And then how does the cost of Earlens compare to normal hearing aids and cochlear implants? So compared to normal hearing aids, it is more expensive. We have traditional normal hearing aids ranging from $1,800 for one hearing aid all the way up to $3,800 for one hearing aid. So with these, it's a little bit more expensive. The price of a cochlear implant, that's typically covered by insurance. It's more expensive, but usually that's not an out-of-pocket cost. Life expectancy of the Earlens. Dr. Shohet, do you want to talk about how long the lens can?
I think that the lenses are warranted for several years.
I believe it's 3 years.
3 years, and I think that they can be replaced, and usually the company keeps your ear mold impression on file, so that hopefully we would not need to remake the ear mold impression. But I think that the lens, I think we've had some patients with it over 3, 4, 5 years.
Yeah, I think 4 to 5 years, we still have some patients wearing their
same
original
ones.
device.
Yeah, so I think they can last several years. The external part may have to be replaced periodically because it's exposed to the elements, and it's electronic. So I would say similar to hearing aids, you're looking at replacing that part every 3 to 5 plus years.
Yeah, and we usually remind you before the warranty expires so that if we need to replace a part or your lens needs to be replaced, that we can do that under warranty before there's a charge out of warranty. Any side effects?
Not sure what's meant here. I'm guessing they mean when you take the ear mold impression, side effects or some discomfort. I've had some patients with a little bit of blood from a scratch in the ear canal when we pulled it out. But other than that, no, I have not seen any significant side effects.
The Earlens batteries. So the piece that sits on the eardrum, the lens, doesn't take batteries, but the piece that the processor on the outside is a rechargeable battery. So it will come with a charger that you set them in every night. If you charge them every night, they should last you the full day. And yes, the processor portion needs to be removed before going in water, but you can swim with the lens on your eardrum. So before showering as well, you want to make sure you take off the outside part. What choices of hearing aids are available for moderate to severe loss? There's lots of different options, lots of different hearing aids. So it really depends on your hearing loss, your word recognition, the environments that you're in. But if you come in and have us take a look at your hearing test or do an updated hearing test, we can go over all those different options. The least visible type of hearing aids. There's two that you can't see at all. One's a fully implantable hearing aid that Dr. Shohet implants. That's called the Esteem. And then the other type is the Lyric. And that's the one that Dr. Shohet mentioned as well, that gets seated down close to your eardrum and stays in there for about 2 to 4 months before it needs to be replaced in the office by one of the audiologists. The illustration chart seems to show the ear lens deep in the inner ear. How is it inserted in the inner ear, and will it come out? I'll answer that.
I can take that one, Gina. So the lens is inserted just through your ear canal right here in the office. We just advance it. We put it through your ear canal and advance it through the ear canal up to the eardrum. And it's something we do commonly. So it's done right here in the office, non-surgical, just by advancing it in through the ear canal to the eardrum.
Someone asked about wearing glasses with the ear lens. Yeah, you can wear glasses. They will sit right next to the processor, just like traditional behind the ear hearing aids. One thing that we've seen recently that's more of an issue than glasses is masks, taking your face mask on and off. People accidentally take off the device. So that's an issue with any hearing aid, not just ear lens, but anything behind the ear. You just have to be careful when removing your face mask. How long has the ear lens been tested? Do you know that, Dr. Shohet?
So Earlens has been on the market now, I think probably 4 or 5, maybe more years. So they've undergone, before going onto the market, before being FDA approved, they had to undergo a rigorous FDA clinical trial for safety and efficacy. So that was probably a few years before that even. So it's well over 5 years. They've been working on testing this device for safety and efficacy, and through FDA approval, it's found to be both safe and effective.
Does the ear lens effectively relieve tinnitus?
So that's a loaded question. Anything that helps improve your hearing can potentially improve your tinnitus. This is a whole nother lecture in and of itself is tinnitus, but oftentimes by addressing the underlying hearing loss, people will experience a significant improvement in their tinnitus. And that's mainly because a hearing instrument helps amplify the sounds you're supposed to be hearing over the tinnitus that you hear.
How is the outside device connected to the ear lens on the drum? Because the outside piece is removed for sleep and water, but the ear lens stays in. Yeah, so the outside part, again, is very similar, looks very similar to a traditional hearing aid. You'll have a mold in the ear. It does not physically touch the lens, but it sends the sound using an inductive system, but it doesn't touch it. So when you take that out, it won't affect how the lens is seated on your eardrum.
They're not connected. The outer part and the ear lens are not connected. There's no connection between the two of them. They communicate through energy. So there's an energy that's sent from the outer part to the ear lens. There's no physical connection between the two of them.
Since a cochlear implant procedure can affect your current hearing, would you recommend trying the ear lens first? It depends on your degree of hearing loss. Ear lens is not an appropriate device for severe to profound hearing loss, where a cochlear implant would be. So again, you can schedule an appointment. We can look at your hearing test, see how your current hearing aids are working for you, and kind of discuss the next steps. But ear lens would not be appropriate for someone who's also a cochlear implant candidate. Are there hearing aid devices available that focus more on increasing overall volume transmitted to the inner ear with less focus on specific frequencies related to speech? For example, if one's not worried about speech, but more interested in improving overall volume received. So if you're just looking for volume, you can get a device that just increases volume like a pocket talker. But if you have hearing loss, volume is not usually the concern. We need to adjust the hearing aid and program the hearing aid to your specific hearing loss, which is giving you volume, but different amounts at different frequencies. So yes, there are devices that increase volume, but those are not intended for people with hearing loss. Does ear lens affect vertigo?
So I'll answer that. Ear lens should not cause nor aggravate vertigo. Overwhelming majority of causes of vertigo. There's only one type of vertigo, cause for vertigo I can think of, maybe a couple, that might be aggravated by just loud sounds. but certainly not by hearing. So the answer would be no.
Do you accept HMO insurance? We do accept lots of different insurances, but most insurances do not cover hearing aids. We would check into your specific plan, but wouldn't expect insurance to be covering the cost of the hearing aids. But we can certainly bill insurance if we're in network for hearing tests and visit with the doctor or one of the PAs. How does earwax removal affect the ear lens?
So you do have to, some people periodically have to have the earwax removed. It needs to be done here in the office. You cannot use a Q-tip when you have, well, you should never use a Q-tip, but you should never use a Q-tip, especially when you have an ear lens in, because the little fibers of cotton that you put in with the Q-tip can grab hold of the ear lens and pull it out. So earwax removal should be done here in the office. You'll find, and what we found is that most people don't accumulate as much wax when they're using mineral oil frequently in their ear canal. So that's part of wearing an ear lens, is using mineral oil, and using that mineral oil actually helps a lot of people not accumulate too much wax.
And then I think the last question is, does the outer portion of the ear lens need to be removed when sleeping? Yes, we do recommend that you do remove the outer portion. It needs to be charged overnight, so it needs to be put in the charger so that it'll work the next day. And it can also damage the device. It can cause the cord to break or the wire to break or fall out of your ear and lose it. So you should take it off when you sleep.
Okay.
I think that's it.
Some good questions there.
So we are offering free demos of the Earlens device in our office. So please call any of our 3 locations, Newport, Seal Beach, or Irvine, to schedule that, and let the front desk or whoever answers the phone know that you want to schedule the Earlens demo. So we'll set aside enough time to check your hearing, talk about the appropriate devices for you, and let you listen to what it sounds like if it's something that is appropriate. And yeah, please come in and call us. If the Earlens doesn't seem like it's appropriate for you, but you're interested in something to help your hearing, call us anyway. We can definitely help you do an updated hearing test.
Yeah, I would urge you, if you have a hearing loss, if you feel like you're having issues with your hearing, get a good comprehensive audiogram, and that will help us determine what's going to be the best option for you to hear. And we take all of these things into consideration: what your hearing loss looks like, what other considerations in terms of your anatomy, what the shape and size of your ear canal are, and what you're looking for in terms of cosmesis, how you want it to look, if you're someone who really wants something invisible versus doesn't care. All these things need to be taken into consideration when determining what is going to be the best type of hearing device for you.
And we do, with the Earlens, have a way for you to listen to what it would sound like without actually having to go through the trial and the procedure. So you can listen to what your current hearing aids sound like and compare it to what the Earlens sound quality is, to decide if it's something that you think would help you or would improve your quality of life. Someone also asked if they would be getting a link for the presentation, and you will. We will be emailing out a link after we're done with the webinar.
Great.
All right.
All right. Thank you, everyone, for being part of this. And thank you, Gina, for helping me out with this.
Thank you. Thanks for having me.
All right. Bye-bye.
Bye.